Good morning, students. Now the topic is new topic is urine culture examination. That is cultural examination of urine. In cultural examination of urine, in this the one loop full, and this loop is of 4 mm loop that contains 0.01 ml of urine sample. It is inoculated on the Macon agar indicator media, and one loop full of sample inoculated on the blood agar, which is acting as the non-inhibitory media. The Macon agar shows the pre-assumptive diagnosis of bacteria, which is useful for the diagnosis whether the bacteria is lactose fermenting LF or non-lactose fermenting NLF. LF is lactose fermenting, NLF is non-lactose fermenting bacteria. While the blood agar shows quantitative measurement of the bacteria, how much quantity of the bacteria is present. For the quantification of the bacteria, the colony obtained on the blood agar is multiplied by the colony. For the quantification of the bacteria, the colony obtained on the blood agar is multiplied by 100 to calculate the number of bacteria in 1 ml of the urine sample. The number of colonies are counted on the blood agar media, and then whatever the number of colony obtained, it is multiplied by 100 to get the total number of bacteria present in 1 ml of the urine. The number of bacteria more than 10 to the power 5 per ml of the urine is significant and indicates the infection. The number 10 to the power 5 is called kaise count. That means this number is very important and is known as kaise count. So the number of bacteria more than 10 to the power 5 per ml is significant, and the count less than 10 to the power 4 per ml shows the contamination. That means if the count is less than 10 to the power 4 per ml, it means there is the contamination of the bacteria and the count between the 10 to the power 4 to 10 to the power 5 is equivocal. That means there may be contamination or may be due to infection. For the patient on antibiotic or diuretic drugs, for the patient on antibiotic, not on, and this is on. If the patient is on antibiotic, that means he is taking antibiotic or using the diuretic drugs with some bacteria. If the person is taking the antibiotic and or the patient is under diuretic drugs, they are taking these type of drugs, then in such a condition with some bacteria like the Staph aureus, even the low count is significant. That means if the count is less than 10 to the power 5 or 10 to the power 4 per ml, but the patient is under antibiotic or diuretic drugs, then especially for the Staph aureus, even the low count is significant. That means the patient is having the infection. The isolates which is obtained from this bacteria, from this media, are further identified by the biochemical analysis, biochemical properties and antibiotic sensitivity test. So further they are identified whether which type of bacteria is this one. These are tested by the biochemical properties and the antibiotic sensitivity test. The commensal such as the Acinetobacter and the diphtheria, commensal, these are the commensal bacteria. These are the commensal bacteria such as the Acinetobacter and diphtheroids present in the urethra. These are commonly present, not as infection, they are commonly present in the urethra and comes in urine. They may comes in the urine of the patient, so it should not be reported. These are the commensal bacteria in the urine. The common urine pathogens, which are commonly present in the urine sample, the pathogens which are commonly present in the urine samples are so the common urine pathogens, the pathogens, their wet preparation and their gram smear can be identified to find out the types of bacteria. Which bacteria is this one? The E. coli bacteria. First one, E. coli bacteria, they are motile rods in the wet preparation. वेट प्रिपरेशन में ये मोटाइल होगा और रॉड्स होगा. एंड ऑन ग्राम स्मीयर दे आर ग्राम नेगेटिव बैक्टीरिया. अनदर वन इज द क्लेप्सिला विच इज द नॉन मोटाइल रॉड्स एंड ऑन ग्राम स्मीयर shows the gram negative. Proteus which can be identified by the motile rods on the wet preparation and on gram smear they are gram negative. The Pseudomonas aeruginosa, this is the one of the colony of the Pseudomonas which shows the which are motile rods on the wet preparation and on gram smear they are gram negative. Another one is the enterococci bacteria which are cocci in the short chain in the wet preparation and shows the gram positive on the gram smear and can be identified and further can be treated after the sensitivity antibiotic sensitivity test. Okay, thank you.